I'd also say be careful of fasting too much. Some people, they do really well with intermittent fasting and it could be helpful. Some need to have some protein and some fat and a little bit of carbs before bed because their blood sugar may go low while they're sleeping. So if you find yourself waking up in the middle of the night, one of the best strategies is have a little bit of a mini protein shake, whether it's a collagen, magnesium, kind of a coconut milk, maybe a little bit of berries in there, just a little bit of protein, a little bit of fat, maybe a little bit of carbs. See if that kind of stabilizes your blood sugar. The goal is if your blood sugar gets too low, your body can utilize cortisol and adrenaline to pick that blood sugar back up. The problem is cortisol and adrenaline, as it picks that blood sugar back up, it also wakes you up because it stimulates you, right? And so then you can fall out of sleep. And that's a big concern. So managing blood sugar before bed and or if you wake up can be very helpful. And we'll also do some sublingual formulas if people wake up just to kind of help get back to sleep. Again, the problem with it is if you're like an hour or two away from when you're supposed to get up, that can be problematic because maybe you're a little bit drowsy going into the morning. But if it's in the middle of the night and you got like 3 hours or so, then you can definitely take that and that'll help you get back to sleep. But good diet lifestyle strategy is super important. And then we have to look at the circadian rhythm and the cortisol levels at night and in the morning because we'll look at these, we'll test these with our patients, and that'll give us a good insight. And one of the big things is just trying a little bit of food and or shake in the middle of the night, and if that helps you get back to sleep, or a little bit before you go to bed, if that helps prevent you from waking up, and there's probably a blood sugar connection.
Yeah, if you're listening to this and your head is spinning, we do consultations. And so this is how we tease things apart. So you're just getting an insight into our brains. So you're just kind of tuning into Justin and I riffing. We didn't plan this. We didn't schedule this talk in terms of like, how are we going to dive into this? This is us riffing. And so I hope you guys enjoy this flow. Because this is how we think when we're approaching a situation with a client who comes to us and says, "Hey, I've got sleep problems." We're running through this in our heads almost instantly. The cortisol, the blood sugar, the stress, the emotions, the gut. I mean, we're just kind of filtering all this on our head. We're processing it. We're listening to your symptoms. We're matching up gut symptoms with skin issues, with mood issues, with sleep issues. And then we're creating almost this mental map
Right.
in our head. We're creating this like spider web of what part of the web is disrupted in this person. Where do we need to go? What part of the web do we need to reconstruct to get this whole symphony working together? Because sleep is a really complex thing. And there's a lot of things that have to be going good to have good sleep. I mean, it's no surprise we're in an epidemic of people taking sleeping medications because, as you've listened, if you've been somewhat paying attention through this podcast, you're hearing there's a hormonal component, there's a neurotransmitter component, a gut component, an infection component, a blood sugar, possibly a blood pressure component, a heavy metals and other toxins component. So this thing can get really complex. And so if you just go to the doctor and you get Ambien or a sleeping medication, all you've done is put yourself in somewhat of a drug coma. You've done nothing to fix any of these root causes. And if you have toxins or other issues creating the sleep problem, you're just getting further and further away. And it's really sad to see how commonly the sleep medications are passed out like candy, because what they don't tell you is it's very difficult to get off of those drugs, especially if it's in the benzodiazepine category where it's like an anti-anxiety and sleep remedy like lorazepam. Those things are incredibly addictive, incredibly powerful drugs that are very hard to get off of. So we just prefer you guys think root cause. It doesn't have to be revolutionary, but I guess it is, because the conventional medicine approach to this stuff is garbage.